Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Hello, I'm Dr. Candace Pierce with Elite Learning by Colibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. Our discussion for today for this series is trauma-informed care, and joining me for this discussion is Abby Schmidt. Welcome back, Abby.
Thank you so much for having me.
Absolutely. I'm really excited to learn more about trauma-informed care, and kind of what I know about it is that it's a framework that really recognizes the impact that trauma has on individuals, and really just tries to emphasize safety and trust and empowerment within healthcare settings. So what I'm hoping through this series is that we're able to just really break down the foundational principles of the trauma-informed care framework with the goal to just equip our listeners with the knowledge to try to integrate these principles into their practice.
Yeah, absolutely. And moving forward, it's important to kind of break down trauma itself. So what exactly does that look like? It looks like a variety of different things. But from a healthcare standpoint, sometimes we as providers think trauma, when we hear trauma, we think bodily injury or traumatic injury, even a trauma unit. But that's under the broader view of trauma. So can you think, just spitball ideas? Are you familiar with different types of trauma?
Well, yes, I know one of the traumas that we hear a lot about and a lot of states have mandates on is, domestic violence. Also, being a mandated reporter for child abuse. Um, so those are the
Yeah.
two that really stand out to me is that domestic violence, child abuse, betrayals from, family, from friends, from, spouses also, I think really um, brings about a big trauma response. And I know that trauma informed care is really associated with fostering that healing and that recovering for patients. And so it really focuses on the interactions and the outcomes. But can you help us understand what is trauma informed care? Why is it important?
Yeah, absolutely. So the majority of people, evidence and studies have shown that most people will experience a traumatic event. So it's important because we will definitely come in contact with someone who has history of traumatic events. Um, So, trauma informed care is basically a shift in how we see people, from a body with symptoms to an actual whole person with lived experiences, both good and bad. And I think about it like a suitcase, like everyone's just walking around with an invisible suitcase, and in it is their lived experiences, whether it be good and bad. The majority has a combination of both. But for some people, they just have an abundant amount of trauma, which is, the fear and a loss of an ability to cope. So going back, I know we had spoken about trauma itself, but the DSM-5 terms that are defined it as emotionally overwhelming, highly upsetting event. So essentially, this is when individuals who have either gone through, ongoing or at an early age, they can't quite cope any longer. They can't function and they can't process it because they can't move forward. So, the care that I'm hoping, or that that is the goal of the trauma informed care model, is that we don't actually diagnose PTSD, but we look at how the trauma is impacting their relationship with care and their willingness to seek care. And like you said, the safety, and make sure that we are providing safe care and looking at the whole individual.
I saw a statistic you were talking about most people that we come in contact with has experienced or will experience a traumatic event. And I saw a statistic that upwards of 70% of adults in the US have experienced some type of traumatic event at least one time in their
Yeah.
life. So, you're pretty much guaranteed as a provider that you're going to run into a patient, multiple patients probably in a day that have had this traumatic event in their life. So, how
Mhm.
does that trauma, that traumatic effect really just impact the physical and mental health of someone?
Right. So there are a lot of times we'll hear it's just in your head, or, think positively,
Yes.
or just calm down. Well, there are, proven evidence, or there's proven evidence that there are neurobiological processes that tag along with that psychological trauma.
Mhm.
So, first and foremost, when someone has experienced trauma, their brain and their nervous system can become wired for survival brain to become a priority over logic. I'm sure you're familiar. You may be familiar with survival brain, um,
Mhm.
and that just there are
You just
different.
live in that fight or flight state, and you can't come out because your nervous system doesn't recognize what safety is anymore, even when you're in a safe place. And so you just live in this state of I have to survive.
Exactly, and the part of the brain that's specifically called the survival brain is the amygdala.
Mhm.
So it initiates that fight, flight, or freeze, and the body stress response system. So it's fast and automatic, and it kind of takes control, and it minimizes the logical brain, which is the prefrontal cortex in the front. That's the part that's like, oh, this doesn't make sense. Let's think about this. Let's think this through. And
Mhm.
I don't want the amygdala and the survival brain to get a bad rap because we need it. It's a good
Yeah.
thing. The main goal is to keep us alive. So it's very important. But when it's repeatedly triggered in these patients, it can have devastating physical and emotional and psychological effects. So the chronic stress correlates with cardiovascular disease, autoimmune diseases, um, uh, gastrointestinal different conditions like IBS,
Mhm.
and also
Mhm.
chronic fatigue, because essentially so often those areas of the body are getting neglected. When your body thinks you're about to die, you're not your
Right.
brain isn't going to say, "Oh, I need to digest what I just ate," or "I need
Yeah.
to protect myself from a microorganism," or something like that. It dulls those functions. And as far as the health side is depression, PTSD, anxiety, and we'll often see substance abuse disorders.
To try to numb the feeling, to try to get it to go away.
Right.
Super high cortisol levels too, and I mean the super high cortisol levels really do a number on your body that we don't realize
Yeah.
just how bad it is.
Yeah, absolutely. Yeah, I think that it's called the hypothalamic pituitary adrenal axis, or the HPA, and it
Mhm.
initiates all sort of metabolic and hormonal triggers. So it's not just psychological, it really is
Mhm.
systemic.
Yes, and you can't control it. You can't come out of it. Um, so that's why it's so hard when you hear people like, just calm down, but it's like, I
Yeah,
can't. I don't know why, but I can't. Um,
right.
what are the key principles of trauma informed care? And then how can we start to apply those in practice?
The I like there's a lot of models and different frameworks, but I like the Substance Abuse and Mental Health Services Administration. So along, but in a
Yeah.
nutshell, the SAMHSA.
Essay. Yeah, I was about SAM. Yeah.
Yeah, I think I don't know if I'm saying that right, but SAMHSA, they have 6 principles. So safety, trustworthiness or transparency, peer support, collaboration, empowerment, and cultural inclusion. So those are the basic, and I really like that because it hits all the important topics. So first and foremost, the safety that we had talked about, and avoiding re-traumatization, because that is what we're trying to avoid, is making them relive it again. So one of the components in practice with safety is explaining, so safety and predictability. So explaining everything that we're doing before. It may sound, you may feel odd or uncomfortable at first, but
Mhm.
anything you do, even if you're going to, if you're going near, hey, I'm going to grab this pin near you, or especially when you're about to touch them. Okay, I'm going to touch you. I need to get your blood pressure. It's just a normal, process. Things like that. Explain why you're doing it and what you're
Yeah.
doing, and then also reducing loud noises, bright lights, as far as as much as possible.
I
And
want to go back to touching real quick before you move on, because I see this too for pediatric patients, not even just traumatized, patients who come in, but for example, I took one of my daughters to an ER a few years ago, and the nurse comes in. She doesn't tell me what she's doing. She doesn't tell my daughter what she's doing. And my daughter was in middle school at the time, and she takes my daughter's arm and she ends up either starting an IV or taking blood. I can't remember which one it was, but she doesn't tell her anything that's happening. And you're watching this with my daughter, but you're, as a nurse, like, think you're watching this child that you're basically, you are creating a traumatic event for this patient by not even telling them what you're doing. Hey,
yeah,
I'm going to take your arm. I'm going to take some blood. This is what I'm going to use. This is my name. You didn't even introduce yourself and say who you are. And so, in moments like that, I think we can cause a traumatic response to our patients. Then they come back to the hospital and they are going to remember, and they are going to have that fear as well. So, when you're describing some of these things, a lot of it to me just makes sense that this also prevents this from being a traumatizing event for somebody.
yes. Yeah, absolutely. That's a major, because we can be so focused on our
Mhm.
duties and the things we need to get done, that we're not realizing that we're actually interacting with a human being that is not familiar with. We've
No.
done it 100 times,
Yeah. But
but
that
they have
pediatric
not.
patient has usually not, and a lot of adults have usually not. Like, for me, I'm a nurse, and I know what you're about to do when you walk in. I would still love for you to introduce yourself and tell me what you're gonna do, but I see what you're carrying, so I know what's coming. But you have patients that don't know what's coming.
Yeah, exactly. The fear of the unknown. If you'll just explain that very quickly, you don't have to go in depth
Mhm.
and say, well, this is the name of the device and I'll be collecting 2 mLs of blood. You just
Yeah, I
explain
don't
it on
even, yeah.
basic terms. Yeah, it
Mhm.
doesn't take very long. Yeah, absolutely. Another point, is when you've realized that someone has had either a very recent or a far in the past traumatic event, one thing that maybe is a misconception is retelling their story. And as nurses and as just human beings, we kind of think, oh, well, they need to get it out. And you say, what happened? Our curiosity takes over and says, what happened? That is a major trigger
Mhm.
for a lot of people. They have to repeat it over and over again. You can always say things like, I'm here if you decide, if you make the choice to share with me what's happened or share with me an experience. I'm here, I'll listen. You're safe with me, but don't feel pressured to talk about it unless it's absolutely necessary.
Mhm.
If it's something that they have to do for their care, if they have to go into detail about, so we can evaluate things like that.
Right.
But yeah, and what you said, explaining or introducing yourself, that is the next, point and principle, is the trustworthiness. So, just being consistent, honest, transparent about what you're doing and why
Mhm.
you're doing it, even if it's uncomfortable, even if you
Mhm.
don't want to, um, do that. It's important, even with errors. When I worked in the emergency room, I had made a mistake, and I didn't want to tell the patient. I just,
Yeah. Yeah.
I had, and so I had it actually. I had drawn their blood and I sent it off and did the wrong thing, and I needed to redraw it because of my own error. So I went in there and I wanted to, first of all, be dishonest and say, "Oh, the doctor
Yeah.
ordered more blood," but I knew in my heart that's not who I am. So I did. I said,
Yeah.
"I made a mistake. I'm so sorry. I can't apologize enough. This is and I remember the service member saying, "Oh, thanks for being honest. I'm surprised you told me. You didn't have to fess up to that," and things like
Yeah.
that. And it wasn't a big deal to him. But yeah, just being honest and explaining if you're using their information and why you're asking questions, things like that, is really important. Um, Also, peer support. Um, Evidence is continuously showing that these individuals with traumatic experiences are healing and showing better improvement and recovery when they have support groups and meaningful
Mhm.
one-on-one contact.
Mhm.
Yeah,
Was that all? I'm trying to remember was there
it's
5?
there's 6. So, the
6.
6th or the 5th, I apologize, is collaboration, so just making sure you're involving the patient in their own care. What do you think this is about? Things like that. And empowerment, giving them a choice at every aspect because a lot of times trauma takes their power away. So
Mhm.
this is the goal is to give them back that power and choice. So yeah.
How can we recognize signs of trauma in patients? Can we, recognize signs of trauma in patients? I
Yes.
really feel like though we should be taking all 6 of those principles anyway because it's good patient-centered care.
Yeah, that's what it's moving toward is universal. It's not kind of like, how standard precautions you put on your PPE,
Mhm.
like every single patient has a communicable bloodborne pathogen.
Right.
And it's the same thing. Treat patients as every single one of them. Like you said, 70%. So 7 out of 10 of them are going to, those three just got extra care. But treat everyone with those principles. But as far as recognizing it, there are ways to, but everyone's unique.
Mhm.
It's important to recognize when they are in crisis. So that's a term that is thrown around a lot, and what it basically means is they have reached that point where their survival brain is in charge, and their logical brain is in the back seat. Their survival brain is driving, and they are
Mhm.
distraught and they
Mhm.
cannot cope any longer. And often we try to prevent that in healthcare settings, but sometimes it's very common that they come in and they're already in that crisis. So, signs of that is increased heart rate and blood pressure, rapid, shallow breathing, often GI upset. So, nausea, vomiting, diarrhea, things like that, gas or stomach pain, chest discomfort. Sometimes they can just be in a state of shock or glossed over. Sometimes they will be disoriented in the
Boy,
hospital.
the diagnosis differential for these patients that you're describing is going to be very tough. I mean, because
Absolutely.
it's like every system is affected, but is it affected because of the sympathetic nervous system, or is it affected because of the reason that they came to see you?
Exactly. So yeah, our hierarchy of priority, yeah, when they've got chest pain and
Right. Here comes that
tachycardia,
workup.
breathing. Yeah,
Yes.
yeah. And a lot of times the signs of crisis, it isn't known right off the bat. It's like days,
Mhm.
weeks later. Says this
Mhm.
actually it was, after exhaustive studies and um, mental health involvement, things like that. But yeah, but before that happens is what is essential to look for too, signs of that they've experienced it, but they're coping somewhat. They're not completely out of control, as far as their life and everything is look for someone, signs may be avoidance, like avoiding eye contact, avoiding appointments altogether. Maybe it's missed
Mhm.
appointments,
Mhm.
multiple canceled appointments. Um, their general state of anxiety, kind of hypervigilance, looking around, um, jumpy, like a few sudden movements may, trigger them to respond in that manner. You'll also see a long list of vague symptoms or consistent ER visits, things like that. As well as they have difficulty describing their symptoms. Maybe it's a headache, but they're not concerned about the headache. They're like, "Well, that's not the biggest. It's my stomach is hurting or my muscles are hurting." It's kind of vague everywhere.
Mhm. It reminds me of when we look at things through a framework, not a framework, through a lens. So you have a patient that is probably looking at everybody and everything that comes in that room through this lens of trauma, whatever that might be. So, like through a lens of pain, um, maybe a lens of distrust because of whatever that traumatic event was. So, everything that you come in and do, they're going to question. So, I just see that these lenses that they are looking at the world and every situation through.
Right. Right, and that when you hit it right on the head because when you say betrayal, they expect betrayal from everyone. It's not just that they're maybe, wondering. It's like, okay, this person's probably going to somehow betray me and betray my
Yeah.
trust. But yeah, absolutely. That lens, that's a really good way to put it. I like that.
When it comes to our role and how we should be interacting with that patient, where do you see the role of empathy and the active listening that you're taught in nursing school and probably med school of how to listen to what patients? So what role do you see those playing in this framework of trauma informed care?
Yeah, they play a huge role. And one aspect that I'm not sure if you kind of went over it in nursing school, but we didn't really talk about self care because
Uh-huh.
a lot of
We
times,
didn't.
yeah, we didn't either. A lot of times have you heard of the airplane? Like you have to put your oxygen mask on
Yeah.
before you help someone
Somebody
else.
else's. I wasn't taught
Right.
that in nursing school. It was I
I
put their
wasn't either.
oxygen mask on,
Yeah.
and then maybe I'll get time for my own, maybe.
Yeah, we can't. We
Mhm,
we can't if we don't show ourselves compassion, then we can't provide it genuine compassion to others and empathy, and
mhm,
just self care. So that it starts there, just giving yourself the time to heal from anything that we've experienced, and we don't have to reach far because we've either seen it firsthand or experienced it in personal or professional life.
mhm.
So, a huge portion of this goal is to show empathy and active listening. That is a biggie. That's hard because we have already a workload that seems overwhelming as it is.
Right.
But it is important. So active listening is just fully engaged, fully committed to what this individual at this moment, kind of like mindfulness. Like let everything go except for that, unless it's something you hear a code, things like that. But and just focus, and that really has to do with eye contact, validating or reassuring them, either repeating what they say back, or saying, "Go on, I understand." Things like that really build that bond of trust and show that I'm investing in you. I'm not here just to take care of your body. I'm here to take care of your whole person.
I like that trustworthiness that you hit on as one of the key principles too. When I think about that, and I've shared this story before on a different podcast, and it was in a different, um, not framework, but like in a different lens, I guess, would be you go into your patient's room. I got report about this patient, and they were telling me just how terrible they were and how needy they were. Um, but all I did during that particular shift was tell the patient, "Hey, I'll be back at 2 o'clock to check on you." And hey, I showed up at 2 o'clock or it might be a few minutes late, but around 2 o'clock, I'm going to be back to check on you. And I went back and checked on them. Hey, I'll be back at 4 o'clock. I'll be, like I gave them a time, and not one time did they hit the call light because they saw that I was going to come back. So even if I was a few minutes late, they knew that I was going to come back, and they would save their requests like, "Hey, can I have ice or can I have something to do?" They would save those requests for me rather than continuing to hit that call light. So I just think it's so important for well, first of all, we have to show that we are trustworthy to them, and that's a pattern. Trustworthiness is a pattern. And if we break that pattern, we have to be willing to be like, "I'm so sorry I was late. My other patient was coding, blah, blah, blah," being honest about why we were late, or um, I think that that's so important for all patients. And because when we do not hit on those principles, then we do cause a traumatic event for our patients. They never came
Yeah.
back. They never came back to see me. I couldn't even get anything to drink. Nobody brought And I don't even think anybody knows I'm here.
Yeah, and it could have
Mhm.
brought back memories of something from the past where someone had said, told them, "I'll do this," and then they didn't follow up. They didn't keep that their word. So
Mm.
then it's like a projection of that event on this is the same exact event, even though your intentions weren't the same.
Mhm. And
But
I think
yeah, I
that
love
really
that example.
And I think that really sets us up too for my next question about healthcare environments and how healthcare environments can be adapted to support trauma-informed care.
Yeah, so we're the whole goal is avoiding that being re-traumatized, right? And that
Mhm.
happens long before you even see the patient. So it's a team effort. It can start, the lighting, the furniture, the parking lot. Is parking difficult? Are signs where you are? Like if you're in radiology, is it difficult? Are there maps? Are there arrows? Are they clearly labeled? Things like that. Before a patient can ever get to you or the waiting room, they may already be at a stress level that's above the roof. So things can only just get worse from there, and they're already aggravated or stressed and potentially ready to leave before they even reach you. So the
Yeah.
environment, and then once they get there, decorations, lighting, smells too, mildew, like urine, different smells really can
Yeah.
have such a the smell is, I've heard this, but the smell is the closest link to memory. So there's
Yeah.
horrible smells. The next time that you think about going back to the doctor's office or the hospital or wherever, it's gonna say, "Oh my gosh," you're gonna get a feeling of dread. So
Mhm. Mhm.
so I want you to just think about this. You don't have to close your eyes or anything, but just imagine walking into this dark hallway and it's kind of dark. Don't see any signs of even where you're at, what unit you're at. There's wheelchairs everywhere. So it's cluttered. There might be a desk over here that's stacked full of papers, and some of them look like they're about to fall off. And then you come up to a receptionist that's barricaded in this like really thick glass, and she doesn't even look at and acknowledge that you're there. How are you feeling right now? How would
I
you say
shouldn't
you're
be
feeling?
here. You don't want to take care of me.
Yeah.
Scary
Yeah, I'm not wanted
place.
here. Yeah.
No.
Yeah, and about the barricade, I know that for COVID, they
Mhm.
integrated more safety for healthcare providers, or professionals, which is essential, but I remember hearing a patient say, "Oh, COVID's gonna need a jackhammer to get through that thing."
Yeah.
So, we need to minimize the PPE as much as necessary so it doesn't look like we are terrified of
Mhm.
getting some sort of disease from patients. But, so now think about how would you feel if you walked in and, it was very well lit, not cluttered. There was plenty of seating, lovely artwork on the wall, maybe a water fountain sound, and just a very welcoming, warm receptionist and that's welcome. We're glad you're here. Things like
Mhm.
that, or
Mhm.
even a station with snacks, just comfort, comfort. It's little things that make a huge difference. Um,
Absolutely.
yeah, so that's a lot about the environment, but and then exits. It's a really important thing to remember that these patients may be making sure that they know where all the exits are because at any moment they want to be able to leave. And or if they are not a flight and they're a fight, they may want to grab something like a lamp because their brain is telling them that they need to fight. So there doesn't need to be a ton of possible weapons around things like that.
Totally off topic, kind of off topic. So, I'm not sure about the other states, but I know in the state of Florida, we have the Baker Act where you can, hold somebody basically in a mental state for up to 72 hours, I believe is what it is. But I was just thinking about this not that long ago, and we're talking about trauma informed care. And you're talking about this warm environment and how this should be. And the very people who need this are those who have been traumatized, which goes back to mental health. I can't think of anything that falls into trauma informed care when I think of being held in a mental facility or being placed under a mental hold at a psych hospital or the department within a hospital. I can't think of anything that makes me see trauma informed care. I see cold, dark, and scary.
Yeah.
And I just find that interesting. What you're describing, what we're talking about here, trauma informed care and the framework of how to take care of people who have been traumatized.
Mhm.
And a lot of these people have been traumatized.
Right. Yeah, and they're in a constant state of fear and a loss of control, so then it's taking away additional losses. Yeah.
Yes.
Yeah,
Placed in a cold
absolutely.
room with nothing, can't even have your own clothes. So as we're talking about this and the importance of this, and I just, I don't know, my mind just kind of went to that. Those people who really do need this mental help
Yeah.
aren't receiving trauma informed care.
There has to be a better way. At
There
this
has
point,
to be.
and yeah, and research and just the initiatives of compassionate people, there has to be more ideas. We have to come together from all standpoints, from the mental health professionals to administration to nursing to, the medical providers. We have to come up with something because the physicians
Yes.
are thinking, well, physical harm, or the providers are thinking, okay, we have to, at all cost, we have to reduce the physical harm or self-harm or harm to others. But what you're doing is kind of kicking the ball down the road, because you're increasing the likelihood that later on they are going to hurt themselves or someone else.
Right. Yes. Well, we are at time for this first episode, Abby. Thank you so much for being here for this discussion.
Absolutely. Thank you.
And to our listeners, make sure that you tune into our next episode, where we're going to continue this discussion and talk about strategies for implementing trauma-informed care in your clinical practice.
This podcast featured content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.